Cell therapy is an exciting treatment that we use for our patients. The immune system is an amazing thing. It's there, it's evolved over millions of years to help keep us safe against infections. What we do is we take cells out of people, out of our patients typically, and we either reprogram them against the tumor or we grow them up in the lab, and then we can simply give them back to the patient to get rid of the cancer.
I see it as a kind of a very humble form of medicine where we're not trying to come up with a cure based on very in-depth knowledge of the cancer. What we're really doing is understanding how immune cells work and being able to kind of tip the balance of the immune system versus cancer in the favor of the immune system.
I think it was vision early on. I think Moffitt's always been an entrepreneurial place. It was the recognition that the immune system was a really powerful way to treat cancer. Not everyone believed that. Early on in my career, many people thought I was crazy for studying the immune system against cancer. They said, that's just a waste of your time.
It was very hard for us to get our papers published, to get presentations at meetings. So you have to think in that type of scenario when you have a major academic cancer center that says we're going to invest tens of millions of dollars into this space because we believe this is going to create major breakthroughs for patients is absolutely amazing. Our goal for patients that come to the Moffitt Cancer Center is, regardless of their cancer, is to have a cell therapy available for them, at least under clinical investigation.
Targeted therapies are a critical part of how we treat patients with cancer. It has really been very innovative and helped to move the field forward for many cancer types. The person sitting next to you in that waiting room, on a piece of paper, they could have the same diagnosis as you, but when you drill down to the genomics, to the DNA level, to the protein level, your cancers are vastly, vastly, vastly different. And that is not just personalized care, I call it individualized care.
Cancer research is not anymore just based about, trying a drug. It's about looking at cancer in an innovative way and looking at how can we target the cancer using new compounds or change the environment in which the cancer is growing and really attack it from several roots. And really that's where one of the great strengths at the Cancer Center is that we have a great relationship between the clinicians and the scientists, and that's when you come with really what I would say is innovative discoveries, things that you're thinking a little outside the box because you're bringing a little bit of information, they are as well, and you're looking at it just in a very unique and a very, I think, novel way.
If I was advising a family member on where to go to get a standard of care cell therapy, there's no question it would be Moffitt Cancer Center. It's the safest and most experienced place to do that. Cell therapies can cure patients, quite frankly. We don't use that word lightly when we talk about cancer care.
We just feel that the current therapies are not adequate. There are 600,000 people that will die every year of cancer. Now that death rate's starting to level off, starting to come down, but it's still around 600,000, so there's a lot to do. And it's just not okay. We don't think cancer is a natural cause of death. We know we can change it.
Moffitt is going to be one of the world's leader for cell therapy, and in essence, we already are, but we're going to kind of grow that lead even further.
We are not willing to accept what is the current standard. We are always pushing that bar and saying, how do we get in front of this? When you have someone sitting in front of you and you're the expert in the field and you don't have the answer, you know your work is not done.